Whether you feel shooting or stabbing pain in your back which is radiating to your legs, whether pain is preventing you from enjoying family life with your wife and your kids, whether the pain is preventing you from day-to-day activities, are you getting absent from work due to constant pains, especially in the lower back? So, if the answer is yes, please do listen to this video. In this video, we are explaining alternative treatments and preventive strategies for relief from back pain. Namaste. Welcome to Ayurveda Health Tips. I am sure at least once in your life, all of you would have faced back pain. Back pain is one of the major causes of disability worldwide, and also it is a major concern for many offices because it is one of the major reasons for absenteeism among employees. So, what are the causes of back pain? Back pain can be due to many reasons, but before we go deeply into the causes, we should understand how our spine is structured. The spine is made of different kinds of vertebrae. For example, the vertebrae at the level of the neck, they are called the cervical vertebrae. They are 7 in numbers. And then comes the thoracic vertebrae, which are 12 in numbers. Then at the lower back region, the most prominent place where you get back pain, that is the lumbar vertebrae, and they are 5 in numbers. Then comes the sacrum and coccyx. These are fused vertebrae. There are 5 sacrum and 4 coccygeal vertebrae. So, like this, 33 vertebrae are there in our body, and between each vertebrae there are intervertebral discs. These discs acts as a cushion which prevents friction between the vertebrae, as well as it also acts as a cushion to absorb shocks for the spinal cord. So, one of the most prominent reasons that we hear for back pain, you all would have heard the term intervertebral disc prolapse. Yes, these discs which are located in between the vertebrae, that can get dislocated due to many reasons. Sometimes it may be due to while lifting heavy weights. Sometimes it is due to wear and tear as you progress in your age. Due to the wear and tear of the intervertebral disc, they get small and it can come out of position. So, intervertebral disc prolapse can be one of the major reasons for back pain. Another reason is the muscle and ligament sprain. When you do strenuous works, when you lift heavy weights, your muscles as well as ligaments get stretched. Sometimes the overstretching can lead to back pain. Then there are some diseases like, for example, arthritis. Arthritis is a disease not only of other joints, because spine is also made of small joints. These vertebrae, they form joints, and in these joints also we can get arthritis, and it can also lead to pain. And there are many other reasons for back pain, and another reason is obesity. If you are having very heavy weight, what happens? The abdominal girth increases and it puts pressure again on your back. Then improper sitting and standing styles, this also can lead to pain in the lower back. So, what are the risk factors? One risk factor is the advancing age. If you are above 40, and especially if you are an elderly person with low calcium levels or osteoporosis, you are at high risk of getting back pain. Then another thing is improper sitting and standing positions. You have to be very careful how you sit and stand if you are having back pain. Then again, another risk factor is smoking. If you are a smoker, chances are that you can get back pain more often than others. So these are the risk factors. Now, what way we can prevent back pain? What are the treatments for back pain? This also we should find out, right? Alternative medicine offers wide varieties of treatment for back pain. the most prominent treatment that we hear in alternative medicine is Ayurveda as well as natural medicine. Both these treatment systems use variety of massages for relief from back pain. But one major question arises. Many people ask me, oh, I am having back pain, whether I can take massages, because I have heard that massages can damage my back region or my spine. No, it's not a fact. The thing is, if massage is given by properly trained therapists, it can really help you to relieve back pain. But if it is from unqualified hands, if it is from people who are not having any basic medical qualification, then it may be difficult. Massage, it will help to reduce the swelling as well as the pain, and also it can help to relax the whole body. In Ayurveda, there are different kinds and varieties of treatments for back pain. But you have to see what is the basic cause of your back pain, whether it is an intervertebral disc prolapse or just it is a muscle sprain. Based on that, the treatment may vary. Sometimes herbal poultices application, they may be used. Sometimes special enemas will be used both in Ayurveda and naturopathy. So, we have to choose the treatment according to your cause as well as the symptoms that you face as part of your back pain. Second, another major treatment that is very popular nowadays is acupuncture. Especially acupuncture has been found very effective in sciatic pain. What is sciatic pain? Usually when the intervertebral disc prolapse is there, this prolapsed disc sometimes it can touch the nerve which is passing through the leg, and this nerve is called the sciatic nerve. And this pressing of the sciatic nerve can lead to shooting pain in the leg, stabbing pain in the legs. So these sort of radiating pains, and it has been found that acupuncture is really effective. Then another system that is equally effective is yoga. Again, many people have this doubt, oh, yoga, whether I can practice yoga when I am having back pain. Very good question, of course. But you have to keep in mind, all the yoga postures cannot be done for all sort of back pain. Again, whether your yoga trainer is having proper medical knowledge, that is very important. It depends upon the courses. Depending upon the courses, you will have to change the methodology of practice. You have to change the postures. You have to change the practices that you choose. So, if the training is given by a properly qualified yoga trainer, of course, yoga can help you in relieving back pain. Again, when the back pain is really severe, during that time it is better to avoid any sort of yoga practice. But once the pain is coming down substantially, once it is coming down, then you can start the practice. But don't practice everything together. Oh, I will do the whole yoga in one day. Don't do it that way. Gradually increase the standard of your practice. So that way yoga can be helpful in relieving back pain. Again, diet is also an important factor. Diet for back pain, it's a big question, right? Yes, diet also has got a very big link with back pain. So try to avoid heavy, spicy and oily food if you are having back pain. Especially try to avoid constipatory foods which can create constipation. Those foods which can create constipation should be avoided when you are having back pain. So these are the treatment options in alternative medicine. But treatment comes after prevention, right? So what you should do? Okay, you have done the treatments and you have come out of the back pain. But what you should do to prevent the recurrence of back pain? There are many things that you should keep in mind. First thing, have a proper lifestyle, healthy lifestyle. Exercise regularly. If you lack exercise in your lifestyle, it can be a contributing factor for back pain. Then again, the food habits. You should avoid those foods which are constipatory as well as include those foodstuffs which are rich in fibers and food, so that you can avoid constipation. Then, three things that you have to keep in mind if you suffer from back pain regularly. One thing is stand smart. If you stand for a long time, always use a low foot stool so that you can place the food on that stool, and alternate your feet occasionally so that the strain will be distributed between both the legs. Then, first is stand smart. Then, sit smart. How you should sit? This is again a major thing that you should keep in mind. If you sit, try to sit straight and try to keep your spine straight, especially when you are driving, when you use computers. Try to keep your spine in a straight position. Thirdly, try to lift the thing smart. Lift smart. How you should lift the object? If you are lifting heavy weights, always try to bend on the knee with the back straight and keep the object which you are lifting very close to the body and try to lift the object very slowly. And if the object is really heavy, try to take help of another person to lift the object. So these things you should keep in mind if you are having back pain. And also while sleeping, try to keep a pillow under your legs so that you can stabilize the lower back. So these small steps, and again avoid alcohol, smoking, excess tea, caffeine, all these things when you are having back pain. Hope this video would have helped you to understand back pain in a new light and the alternative treatments that we can offer as well as the preventive strategy. So if you follow a very healthy lifestyle, eating habit, and if you exercise regularly, we can keep back pain away.